Hi everyone, and welcome to ATP Live Monday. Hi, welcome to ATP Live Monday. I am Sola Boyde, and I'm your host for today. How has your day been? How's your Monday been? I hope not too busy. So, welcome to ATP Live Monday, whichever platform you're watching from. ATP Life Monday is brought to you by Hacks the Pediatricians Foundation. So this is a program where you get to ask any questions that you may have about the health of your children, and you get immediate answers live in the next 60 minutes. So thank you so much for joining me today. Um, okay, so just going to share the video and make sure that okay, I think I need to unpin some stuff. And make sure everybody can see and everybody can hear us. So just give me a couple of minutes to do that. How has your day been? I hope not so hectic. All right, so please also help me to share the video yourself, invite everybody, and so we can have everybody with us right from the beginning. And then we'll share. So welcome those on Instagram, welcome those on Facebook, welcome those on YouTube, welcome. So just give me a couple of minutes to just make sure we share the video to all our various platforms so everybody can see and everybody can hear. Welcome to ATP Live. So if you have questions already and you're already here, feel free to start dropping your questions now. You can start drop your questions. Remember, start your question with the age of the child. It's amazing to me how many times people ask questions and they don't even tell us what my baby, your baby. We need to know the age of the baby because that is so important. Remember that we are not in your house. We can't see the child. So it is what you tell us that will determine what we say. And the age of the child is so crucial. The answer we give to certain questions may be so pulls apart depending on the age of the child, because something that may be normal for a particular age group may not be normal for another age group. So that's why it's always extremely important that you start your question with the age of the child, and try and keep the questions concise and straight to the point. And please ask a question, don't just leave information. A lot of people do that. They leave information, and I'm not quite sure what they want me to do with that information. And as a professional, I avoid making assumptions because I used to do that in the past. And I realized that at the end of the day, it may just be a waste of effort because that's actually not what the person meant. So I find it easier if you just tell me the age of the child and tell me what your question is so that I don't have to make any assumptions. So and then we are all on the same page right from the beginning. All right, so I'm almost done with all my sharing and all my pinning. Just a couple more minutes to pin and a couple more to, and then we'll be good to go. But start to ask your questions now. I've taken 5 minutes already doing all the announcements and all the sharing and all the pinning. By the way, last Wednesday. Is it Wednesday? Was World Autism Day, 2nd of April, and I did a webinar on autism update. So if you've not listened to that webinar, I encourage you to listen to it. And if you have any question about autism, the whole of April is actually Autism Awareness Month. So I'm happy to answer your questions. I've seen a couple of questions on the Facebook group around autism, and so feel free to ask your questions if it is related and autism. All right, so I think I'm done with all my sharing and all my pinning. Good evening, everyone, and welcome to ACP Live Monday. I am Gbemi Solaboide. I'm a pediatrician and CEO Ask Pediatricians Foundation. Ask Pediatricians Foundation is committed to the health and the welfare of your children, of all children globally, but especially for those of us who live in sub-Saharan Africa, where a lot of our children are still dying from preventable causes. You know, I see a lot of news on social media, and it breaks my heart. I saw the viral news of a man that his wife died. You know, pregnant. It's very painful. That should not happen. There's no reason why that woman or that baby should not have made it. Lots of people send me messages in box. So that is why we are here to support you, answer your questions, signpost you to the right areas where if the child needs to go to the hospital. Some people don't like us saying go to the hospital, but sometimes you have to go to the hospital. So if you have any question about the health of your children in the next 50 to 3 minutes, I'm here to answer your questions. Please remember that if you still have any questions after the live session, and especially for those of you who are watching a recording, like if you are not watching live, and live means 6 p.m. West African time on a Monday evening. If you are not watching live in West African time, 6 p.m. on a Monday, you are watching a recording, feel free to post your question on the group, Ask the Pediatrician Facebook group. You can post your question in our group from Mondays to Saturdays, and we'll answer your questions as soon as we can. So the fact that you can't answer your question, ask your question live, does not mean you cannot ask your questions afterwards. So I hope that is okay. I can't see people on Facebook. I hope there's no problem with our streaming to Facebook. All right. All right. Let me see whether I have any question on Instagram. No question yet. So feel free to ask your questions, and I will do my best to answer them in the next minutes I have. So ask any question that you may have about the health of your children, and I will try my best to answer them. And also to let you know that if after the live session you still have questions, please go to our Facebook group, Ask the Pediatricians, and post your questions there. Mondays to Saturdays, 24 hours every day. We will always answer your questions. And we also do webinars on Thursdays, so watch out for our ATP webinars. And remember, you can watch all the past episodes, both ATP Live Monday, ATP Hour, ATP Webinar. You can watch them on our YouTube channel, on our Ask Dr. Gbemi ATP podcast, on our Facebook page, on our Instagram live, Instagram TV, I think. So all these recordings are always there. I think Facebook said they are going to start removing them now after a month or so, after 30 days. But notwithstanding, even Facebook removes them, you can always watch them on our YouTube channel, on our podcast. So feel free to listen, feel free to watch, feel free to follow us on all our social media platforms. And of course, you can also go to our website, www.askthepediatricians.com, and you can read all these articles. I get emails all the time about people who are reading. Some of our articles have been written in over 10 years now, because over almost 10 years July that we've been doing this. I think I think the most frequently referenced article is OCA, because I guess there's nowhere else people will read about that online apart from on ATP. So we get a lot of question about my ABS OCA. I think is the one that most people tend to read and tend to come back, ask questions on it. So feel free to go read up as well. But you have opportunity now to ask your questions live, and I'll write and I'll try and answer them. I still don't have any questions, so that's why I'm still talking. So feel free to ask questions. So while I'm waiting for people to ask their questions, let me remind you, let me create a bit of awareness about autism, which I did through our ATP webinar on last week, Thursday. April is Autism Awareness Month. Autism is a neurodevelopmental condition, and it's rising. The numbers are increasing. Um, so please, if you think your child has autism, please get the child assessed. And I was still surprised to see a mom asking question and saying, oh, somebody told her not to worry, that maybe the child will just outgrow things. No, children don't outgrow things like that. Children need to be diagnosed, they need to be supported. So don't make assumptions. I'll talk more about that, but I think I have a question on Facebook, but let me check Instagram first. Okay, somebody is asking a question on Instagram. Good evening. What can be used to detox or clean the guts? Okay, are you asking for yourself, or are you asking for the children? Because I'm a pediatrician and I like to abide by my own calling. So I like to answer questions that has to do with children. So, but if you are talking about children, please don't detox and don't cleanse any guts. There's nothing to be cleansed. There's nothing to be detox. I'll leave the adults to decide about themselves. But please do not do any so-called detox for children. Let your children drink a lot of water. Let them eat fruits. Let them eat vegetables, and they'll be fine. They don't need to be taking any drugs or any products, so-called products, for detoxing, for whatever. I'm not quite sure what needs to be, what you are trying to achieve, and saying you are detoxing this, you are detoxing that. Anyway, but like I said, I try to abide by my own calling and stay with pediatrics. So in children, we don't detox. We don't do nothing like that. So let our children drink lots of water. Let them eat lots of fruits. Let them eat their vegetables. They will move their bowel regularly, and they'll be fine. They don't need no drugs or anything to be given to them. So kids OK01, I hope that is clear. Thank you. All right, let's come to Facebook. Rachel, Elijah, good evening, docs. Thank you for all you do here. Thank you. At what week or month should we start preparing baby for teething? This teaching question. Teaching is one of those questions that we get saddled with a lot as pediatricians from mothers. The truth is that you don't need to do anything about teaching. You don't need to prepare for it. You don't need to do anything about it. You don't need to do anything after it. So teaching is just like any other thing that children do. The same way they grow, the same way they develop, the same way they start. Do you prepare your child for sitting? Do you prepare them for walking? Do you prepare them for talking? No, you don't. They just start talking, they just start walking, they just start doing everything else they do. You don't do anything ahead to prepare them for that. The same thing applies to teething. It's a perfectly normal thing for children to bring out their teeth. It doesn't cause them any harm. It doesn't cause them any illness. It doesn't cause any issues for children. It's a perfectly normal thing for babies to bring out teeth. Okay. Some babies, when they are about to bring out their teeth, they may begin to rub their gum a lot more. Some may begin to bite on things and all that. Some may begin to draw a little bit of saliva. These are normal things, so it's okay. If you think the child is biting on your breast or biting people, you can give them soft toys to, like something soft to bite on, something clean, hygienic that you can easily clean. Otherwise, you don't need to do anything about teething, so you don't need to prepare for teething. And please do not give your children anything. Don't give them so-called drugs, titi mixture or titi powder or whatever name they call them. You know them. Your so-called Bona Babe, Bomoro, Baby Res, Baby, what other one do you call it? All of them, you know their names. Please don't give them. We don't recommend them. We don't want you to give to children. We don't give so-called titi mixture to children. They are very dangerous to give to children. So just let the children bring out their teeth as the teeth come out. Okay, so like I said, if your teeth is itching, they want to bite on something, you can give them a toy, well, the soft toys, we call them teethers, something they can just bite on, and that is fine. You can keep some of those teethers have like something like liquid in them, so you can keep it in the fridge to keep it cool. And sometimes even just ordinary cloths, wet cloths is enough for the children to bite on. It's just something to cool their gum. They don't need anything special per se for teething. So please do not give them so-called titi mixture. And while I'm still on that topic, please, if your child is sick, do not assume teaching. I get a lot of questions. There's a way parents will start telling you, my child has fever, he has this, he has that, and the child is bringing out teeth, and they are indirectly telling me, oh, do you think it's a teeth that is causing the child to have fever, to be vomiting, to be having diarrhea, to be coughing, to be having rashes? It is not the teeth. So please don't assume teething. Teething does not make a child to be sick. It does not cause fever. It does not cause rashes. It does not cause cough. It does not cause diarrhea. There's not like igbeyin and all those things that people say. Don't make those assumptions. This reason why I'm saying this is if you know how many children we have seen in the hospitals that are very sick and we are battling to save their lives, and then you ask the mother, Mom, this child has been sick for days. Why didn't you bring this child to the hospital? And the mothers always tell, oh, they told me it is teething. They told me it's teething. So I was giving teething mixture and the child was dying. So don't do that, okay? If a child is sick, it is not teeth. Take that child to the hospital. Let that child see a doctor, a pediatrician. Let us do our job, assess the child, treat the child. Don't make assumption that it is teething. It has led to the death of many of our children. This is one of the reasons why children die in Nigeria from things like diarrhea, from things like pneumonia, things that we can treat easily. But because parents will not come to us on time, because they think the child is sitting, and then they come to us last minute, and we cannot always, we're not God. We cannot always save all everybody. So, but if you come to us on time, we will always do our best. So please, again, and I'm begging, if a child is sick, don't think it's teething. Don't give them teething mixture. Take them to the hospital. There is no child that is sick from teething. Yes, quote me anyway. Children don't get sick from teething. That is all these old wives' fables and mothers telling you. If a child is sick, go to the hospital. A child who is sick can be bringing out teeth. It does not mean it's the teething that is making a child to be sick. The child is sick. The teething is just on its own. It has nothing to do with the illness. So take the child to the hospital. Many children wake up every morning with their teeth and nothing happened to them, and you don't even know. You just wake up one day and you say, oh, you have brought out 2 more teeth. That is how it should be. So if your child is sick, it is not the teething, there's something else going on. Please go to the hospital. This is a very important thing. All right. Now, kids, whatever, saying between DHA plus or Ekenfabol suspension, what drug is best for brain development? Let me start by saying the children don't need drugs for their brain development. Again, I'm so worried about kids OKO1. I'm so worried about the kind of question you are asking, and it's giving me a lot of concerns because the impression I'm getting from your question is like you always think there must be a drug you should be giving to children. Please don't. There is no drug that a child needs to take for any normal thing. How do I put that? Maybe I should say it another way. Okay, bottom line, the child does not need drug for anything that is normal. They don't ever have to take any drugs for anything at all. And I'm saying that with all seriousness. Even your so-called multivitamins that people like to give, children do not need any drug, you including your so-called multivitamins, if you do the right things by them. They don't need drug for brain development. They don't need drugs to bring out their teeth. They don't need drugs to cleanse their system. They don't need no drug. In fact, the less or no drug that your child takes, the better for that child. Okay? Children only need drugs when things are wrong. And a kefabol is not something you should just go and be buying. DHA is something your child should eat. Okay, so there's DHA in egg, there's DHA in fresh fish oil, in seafoods. This is where your children should get your DHA from. And if you're not sure of those ones, you can buy milk that have been fortified with DHA. Your children do not need to take any drugs at all, at all. So please, let's stop buying unnecessary drugs for our children. Okay, now most of us think when we are buying drugs, we are buying, okay, I'm buying vitamin C, I'm buying DHA. There are so many things already in those products that you are buying that you don't know, that are not good for your children. There are things that the pharmacists have to mix together with those things that you are buying, so that it can be stored, so that it can stay in the bottle, so that it will not expire. Okay, we call them excipients. And in places where people are not very conscientious, and you don't know anything goes in Nigeria, there's a level of those things that should be in those bottles, and some people are not very conscientious about them. And now that sometimes is sending them to bring back all those products because they've put too much of this, and those things are dangerous to the health of your children. So it is better your children eat their vitamin C. Let them take their fruits. It's better they eat their folic acid. Let them eat their vegetables rather than for you to give them drugs. And I'm even talking of these are things that, okay, at least we know this is vitamins. They are good for your children. But let them eat them. They don't need to take them as drugs. And they don't need to take no drug for brain development. DHA is essential fatty acid that is good for brain development, but they don't need to be taken as drugs. There are things you get in food. If you breastfeed your baby is going to get DHA from breast milk. If you give your children eggs, they are going to get DHA from eggs. If your children eat fish and some of these seafoods, they are going to get their DHA from all those crayfish, your sardine, your salmon. All those things are rich source of DHA. Okay, so children need to eat well. The reason is that most of us don't give our children good quality food. We're only giving them cereals, carbohydrates all the time, milk, and that's it. And some of those milks are not even fortified. We don't even breast. We want to give formula, and if the formula is not fortified with DHA, your child is not going to get DHA. So we don't preach drugs at all. And please do not buy drugs for your children unless a doctor has prescribed them. And I mean that across all board. The only drugs you're allowed to give, paracetamol if your child is having fever, deworm them, routinely, because we live in a country where our children are exposed to high level of worms. But there is no drug that you have to be giving to children, what people call routine drugs, things that they have to take every day so that they can be fine. No, there's none, and there's really no reason why your children should take them. Yeah, if you have a preterm babies, because when they are born, you have not been able to pass some things to them. Usually babies stay long in the womb to get bigger, and for babies, for mothers to pass things to their baby. But babies that are born premature, especially things like iron and folic acid, we've not passed enough to that baby before the baby is born. And so for those kind of babies, we give them those extra things that the mother has not passed to them as supplement because they were born too early. So we give them iron because they need to store iron, and most of those iron is passed to the baby in the last trimester. So babies that are born preterm, they don't have enough iron. So that's why we give them iron. That's why we give them folic acid. And they are also breaking down their red blood cell very fast. Sometimes we give them calcium as well. But apart from that, those are the only thing we give preterm babies. We don't give them nothing else. Even for preterm baby, you should breastfeed them. If you breastfeed them, they're going to get their DHA from the breast milk. Okay, so they don't need no special drugs, except a child who has suffered like brain damage, as a result of that prematurity, or the baby did not cry at birth, then those babies can be treated with drugs because they have a medical condition. So please get the two different scenarios. If your child is a well child, baby, no health issues, please do not give any drugs to the child. If your child is sick, because or your child has suffered any medical condition and a doctor has now prescribed a particular medication for your child, fine, that is the only time you should give drugs. But this one that we all, and please, let's not just be buying drugs, and let's not be using drugs as souvenir. Okay, I've seen people I've seen people tell me that, oh, somebody traveled to US or UK, they brought drugs for us and all that. Please, drugs are not souvenir. Please don't give children drugs as souvenir. Don't go and buy drugs because you travel abroad. Buy them whatever you want. Buy them clothes. Buy them any other thing, toys. Please don't buy drugs as souvenir. These are some unnecessary things that sometimes people do. So please do not give drugs unless we recommend them. And most children do not need no drugs. And I hope I've make myself clear. All right. Evelyn Prince says, should we give children one medicine? Okay, so that question depends on where you live. Okay, so for those who live in the United States, United Kingdom, if you live in developed countries where there are no worms infestation, we don't even give children worm medicine in those places. Okay, but if you live in a places like Nigeria, Africa, where your children are walking around on the bare soil and then they're playing with all sorts of things, they are going to be exposed to the spores of these worms. So they are exposed to worms. We live in what we call worm infested areas. So people that live in those areas, the World Health Organization recommends that we routinely deworm our children. Okay, so if you live in Nigeria, we recommend deworming your children from the age of 1 year, not from 3 months, not 6 months, because your 3 months, 6 months old, they are indoors, they are with you, they are not running around, they are not like, and they are, most of them are on breast milk or food that you prepare. Whereas by the time they're about 1 year old, you are giving them fruits, and some of us, we don't even wash those fruits. Or even if you wash, the children may just go and pick it without washing and eat it. And some of them are walking all over with they are playing with soil, they are playing with all this, so they are exposed to worms. So those are the ones that we start to deworm from age of 1 year, and we deworm them every 6 months. Okay, so that is that for deworming. So you're allowed to deworm children if you live in warm endemic location, and that is that. Okay, all right. So kids, say you have a 3-year-old baby who hasn't walked, so that child has a medical condition. All right, so a child who already has a medical condition has to be under the care of a pediatric neurologist or developmental pediatrician. So if your child is 3 years old, is it the same child that was preterm baby? So if it's the same child, then that means the child must have suffered some brain injury as a result of either the prematurity or whatever other complication the child had. Okay, so this child most likely had what we call cerebral palsy or global developmental delay. You've not given me all the details for me to say which one it is, but most likely. So what kind of form acid should I? I'm not sure what you mean form acid. Okay, so anyway, let me just summarize by saying if you have a child who has developmental disability or diagnosis, that child should be under a pediatric neurologist or developmental pediatrician or community pediatrician for those who live in the UK. Now, those children, it is the job of that specialist to tell you what to do and what not to do. It is not all of them will put on drugs as well. Okay, so there are drugs. If the child is having convulsion, for example, we give them drugs for convulsion. If the child has some other issues, we give them. So, and for those children, the part of the brain that has been affected, we can't fix it. And I think it's important for parents to understand that we cannot reverse brain injury, we cannot reverse brain damage. We can only, but some doctors give like things like DHA and stuff like that because they want the rest of the brain that is remaining not to suffer any other injury and to maximize development. But otherwise, there's really those things doesn't reverse the injury that has happened to the brain. So giving enkephabol, giving all those DHA is not going to make the child to walk. That is not going to what's going to make the child to walk. Okay, because the injury in the brain is from the brain. We cannot reverse that. Depending on how severe it is, if it's a mild one, some children will still walk. But if it's a severe one, some children will never walk. They may need to have other form of walking, and thank God we have a lot of technology these days. So we have wheelchair, we have motorized wheelchair. The important is that the child can move. So whether the child can walk by themselves or they can use the wheelchair to move, we have achieved the same goal, movements. So that is number one. So please, I hope you are seeing a specialist. I hope you're seeing a pediatric neurologist. And please don't take advice from people telling you go and buy this, go and buy that. Don't, please. Always make sure you take advice from the specialist. People can get you into trouble giving you wrong advice. All right. So kids, okay, you I don't know whether your child is seeing one of my colleagues, but that is what you should be saying. All right. Ife Hade Ayade, okay. My 5-year-old has not had any antibiotics in the last 9 months and he has not been sick. Okay, that's good. Can I say has grown adenoids? Not necessarily. It just means that the child has not had any infection. That doesn't mean the child has outgrown anything. Okay, adenoids is a tissue, is like an organ, so which can become swollen, and then it can become smaller as the children gets older, and in some children it gets infected recurrently. It is not in everybody that it gets infected recurrently. So the fact that your child has not had an infection does not mean the adenoid itself has gone. It just means that the adenoid has not been infected in the last 9 months, which is a good sign. Um, and if your child is otherwise fine, you don't need to do anything. But if you're worried, you can always see your ENT doctors, and then they will have a look for you. So, but the good news is that by the time children are between 4 to 6 years, the adenoid tend to shrink on its own. But the way to know that is your child will have a X-ray done, or a doctor will examine the child, and when we examine the child, we will look whether the adenoids is still there, or is it getting smaller, the size and all that. Is it has something to do with the infection. The infection is actually a complication of the adenoids. Okay, all right. Kids OK01. I hope I'm calling your name very well. I don't know. Anyway, they haven't diagnosed anything. They only said your child should have a diagnosis. So if they've told you your child has cerebral palsy, that is the diagnosis. You can't say they've not diagnosed anything. Cerebral palsy is a diagnosis in a child who is not walking at the age of 3 years, and you've been told the child cerebral palsy. That is a diagnosis. There is no other diagnosis you are looking for. That is a diagnosis. Okay. You can ask your doctor point blank. If they are not, sometimes I know what's happened, because sometimes I'm a doctor as well. So I know sometimes we tell parents something, but sometimes parents hear what they want to hear. Sometimes we are in denial, which is perfectly fine. It's a normal human reaction to bad news we don't want. So sometimes parents also don't want to hear that. But I believe that if a 3-year-old is not walking, that child has a diagnosis. Whether you've been told or not, that child has a diagnosis. There are two possible diagnoses. The child can have cerebral palsy. In other words, the problem is only with the walking and the running, and the child may be stiff in their legs or their hands and all that. Or the child is not stiff and doesn't have any physical neurological abnormalities, but the child is not working. In the middle, the child has what we call global developmental delay. So the child is just global developmental impairments, which can actually happen in certain conditions. For example, children with Down syndrome, they don't have cerebral palsy, but they can also be slow walking. They may not walk until 5 or 6, but they may eventually do it. But there is a little bit different. But a child with cerebral palsy has an injury physically that we can see. When I say physically, that we can see through a brain scan or MRI or CT scan in the brain, and we can see that it is due to a particular injury. Maybe the child was born premature, the child did not cry, the child had jaundice, and now we can see the effect. So cerebral palsy is a very straightforward diagnosis. There must have been an injury in the brain that we can confirm on a brain scan. We know why that injury happened, and we can see the manifestation of it. depending on how much of the brain is affected, the child may just have only the physical, problem with the posture and the movement, but the child may not have any other developmental difficulties. But some children may have cerebral palsy with so many other difficulties. Some children will have epilepsy, some children will have speech delays, some children will have learning difficulties. So it depends on whether it's just the cerebral palsy alone or cerebral palsy with other associated issues, but that child will have a diagnosis. But for a child who does not have any brain injury but has a medical reason that is causing their development to be slow, for example, a child with Down syndrome or whatever, that is a different, we call that global developmental impairment, uh, and that is a different time. But both of them can present with the same not working at 3 years, but there's a difference in the two of them. But trust me, I think your doctor should know your child's diagnosis. Please ask them point blank what is the diagnosis for your child, because the reason why I'm saying that it's so important is to know how to support your child. If you don't even know what you're dealing with, then you're not going to be able to support that child properly. So it's very important that you get. I'm happy that your child is talking. So before that your child is talking, most likely again that points to cerebral palsy, because if it's a child with global developmental impairment, the child will be delayed across. It is cerebral, not cerebral. Let me write this. So it's if it's a child with global developmental impairment, the child will be delayed across. So the child will not walk, the child will not talk, the child will not do everything. But if your child is talking and all that, then when you say talking, you mean talking properly, having proper sentences and conversation, not just making sounds. So if the child is doing that, then that is most likely a problem with motor, and that is cerebral palsy. And yeah, and for me, if your child is not walking at 3, I won't call it mild cerebral palsy, but I really want you to see a pediatric neurologist, okay, for further evaluation. I hope you're getting physiotherapy. Your child should be getting physio as well. Those are the kind of support that you should be getting. All right, Lorita Mo say, good evening. At what age do children build immunity? Children are building their immunity from the time they were in their mother's womb. Okay, so when the babies are in the womb, when you say immunity, do you understand what the word immunity means? Immunity means your ability to resist or fight infection. So the reason why we are not sick, the reason why we're all walking around, despite the fact that we have millions of germs, viruses, bacteria, all of them swirling around you, the only reason why you are not sick is because your body has some agents, what we call their own soldier, that protect your body against those germs. That is your immune system. Okay, so you can imagine that if a baby is born and they don't have no immunity at all, the baby will be sick and will be gone. So right from the time a baby is in the womb, the mother is passing some of our own protection or our own immunity or our own antibodies and stuff. The mother is passing to the baby right from the womb. Then when baby is born, we told you to breastfeed your baby, because that colostrum, that first milk that comes out from the mother's breast, is loaded with immune agents. It is the baby's first immunization. That is the same thing we do when we do immunization. We are also building. So the baby already have some level of immunity from the womb, but of course it is not enough because the baby is not been exposed to all these germs. So the mother has to protect the baby by giving breast milk. So through breast milk, additional immune products are passed to the baby. Then we give your baby immunization as well to stimulate the baby also to produce his own antibodies. So immunity is constantly growing. You're giving your baby food. Those food will help the baby to produce all those antibodies, because they need protein, they need all those things to produce those immune agents. So babies are constantly building their immunity from the womb. So there's nothing like when, if the baby does not have any immunity at birth, that baby will be dead within days. Actually, that is why some babies are actually born with those kind of conditions. They are born with condition where they have what we call primary immunodeficiencies, where they don't have any immunity. Most of those babies don't survive. Most of them do not survive because they won't be able to protect themselves, or we have to keep them in a kind of a cubicle where they can never be exposed to germs or infections and stuff like that. And it's so hard to maintain that. But we do have we actually have children who have those kind of disease condition where they are born without any ability to protect themselves or form immunity. So immunity is something the baby is born with. It's something the baby continues to develop. It's something that we also support the baby with. The mother is supporting with, pediatrician are supported by giving immunization, so that the baby keep on uh, developing ability to resist infection. And that is what immunity is all about. So I hope, Loretta Mogul, you got that answer correctly. All right. Okay, our time is almost up. We have 20 more minutes, but feel free to still ask your question. So while I'm waiting for more questions, let me just say that it is building on what Loretta Moore said about immunity. It is important that we give our children opportunity to develop their immune system. Okay, and one of the ways we do that is through immunization, because sometimes the way you develop immunity is when you are exposed to particular germs, your body start to fight them. But if it's the first time, your body is not able to fight them well, and sometimes depending on who wins, either your immune system win or the disease or the germ win. So when children are sick, it's because the bacteria or the fungal or the viruses, they won. So that is why the child is sick. They won the child's immune system. But if the child wins, then your child will not be sick. So that is why we give our children immunization. Immunization is a way of boosting their immunity, so that when they are now exposed to that particular germ, they are super ready. So please ensure that your children gets immunized. Okay, all the measles vaccine. We have an outbreak of diphtheria in Nigeria now, in Lagos, and I think one child died in King's College from it. So please, these things are not joke. This, some of us take it for granted. Please, it's important. Let's make sure that we take our children for immunization. That is one way of boosting their immunity. Another way of boosting children's immunity is by making sure they eat well. They eat good food, because the immune agents are, we need protein, we need all these agents to form them. So your children needs to eat well. Then actually let them take a lot of fruits and vegetables, because those vitamins and minerals, they are essential agents to some of these immune cells work. So for the way the immune cells work, I'm trying to avoid using medical jargon, so pardon me if it's like I'm breaking. The way those immune cells work, they need some environments to be appropriate. So they need also, and those are the ions, the minerals, the vitamins that we take. So that's why it's so important to take them, because they provide the right environment for the immune system to function, to do their work, because most of them are enzymes, most of them are made from protein, and then they need the right kind of environments from some of the work, the vitamins and all the rest of them to be able to function properly. So I hope that's helpful. All right, so while I'm waiting for more questions, let me just remind us again. I was going to talk a little bit about autism. Do I still have my presentation? Um, yes, I still have my autism awareness presentation. So I talk about autism, and I talk about the fact that autism is seeing the world from a different perspective. People who have autism have a little bit of difference in the way they react to things, in the way they understand the environment around them. And it is so important that parents understand that, and we recognize it and provide the right support for them. Otherwise, they are going to struggle. And so that is what autism is about. So I think the most important thing for me to say, because I'm not trying to do my presentation all over again, is to talk about the things that are different in people with autism. They have problem with their social interaction. Some of them also have what we call difficulty with communication. The communication, not necessarily that they are not talking. Some of them may not be talking, but some of them, even when they are talking, they are not able to use that their speech for what we call social communication. There are ways you communicate, interact with people through your speech. Sometimes they have very literal. They take things exactly the way you said it. They don't understand what we call the implied meaning in words or jokes or sarcasms. It may be lost on them, so they may struggle with that aspect, and then they have all these their own what we call restricted, repetitive or stereotype behavior. They like things to be done in a particular way. They may not like change. They like to have their routine. They like to do some things over and over again. So if you see there are lots of screening. Let me stop screening. There are lots of screening tools online for children like between 16 to 30 months. You can use the M chart to screen, and this is recommended for all children. Please, if you have a child between 16 to 30 months, screen them for autism on MCHA. They don't need to have any symptoms, just do the screening. The American Academy of Pediatrics recommend we screen all our children from the age of 16 to 30 months because early intervention works. If we're able to pick it up early and we give the child the right support, they can do much better. And if your children is already older, we also have other screening tools like the CAST and social behavior. There are many of them. Just Google screening for autism and then say the age of your child. You come up with something that you can use. And if you pick it up, please see the right professionals, usually the developmental pediatricians or pediatric neurologists or psychologists, clinical psychologists, or child and adolescent mental health professionals, or psychiatrists. So those are the kind of professionals that can do autism assessment. Of course, with speech therapists, some occupational therapists as well. It is important that we go to the right people because I think I got a question about the mother who said they were told there's nothing wrong with their child, and obviously the mother knows something is wrong, which is one good thing about mothers. Mothers always know. You always have this intuition. You always know when something is just not right. Please don't ignore your intuition, and please keep pressing, keep until you get to the right professional. Unfortunately, we don't always have all the right specialists, so sometimes I think it's the fault of the health professionals because we don't know much about some things, and then we just kind of say, "Oh, don't worry, just ignore it." Please make sure you get to the right professionals, and then get the right assessment done. Another condition another thing I need to state is that our conditions in developmental disabilities, they tend to look alike. Okay, so for example, like Kixo KO1 was asking me questions, and you can see I was saying it can be this, it can be that, because a child who is not working does not necessarily mean the child has cerebral palsy. It could also even be global developmental impairment. It may not even be Down syndrome. There are many things that can present the same way. The same thing when you talk about a child who is not talking. It's not everybody who is not talking or who has speech delay that has autism. So some children have what we call isolated speech delay. They are just slow with their speech, but all the other aspects of the development is fine. It does not mean they have autism. All right. And it does not mean that the converse is also true. It doesn't mean that the fact that your child is talking or your child gives eye contact, that does not mean they can never have autism. They can have autism even with that. So basically, there is not one thing that in medical jargon we say pathognomonic. There's not one thing that once you have it, it means your child has this, or it means your child can never have that. When it comes to autism, there's not one thing like that. So please see us for proper assessment. And I think now there's a lot more awareness. I think we have a lot of more centers providing therapies. Of course, it's still expensive for those of us in Nigeria. And we are hoping one day the government will listen to us and start providing support around getting the assessment done and getting the diagnosis. But for now, at least make sure your child is not missed and the child is given the right support. Okay, Evelyn Price Prince. Okay, say, oh, I've been following your page since 2017. Oh, wow, that's amazing. Thank you so much for following us. As a new mom, then your page helped me navigate the phase of my life with my neighbor. Oh, that's amazing. Okay, I did not give drugs for teaching. Well done, and you helped me a lot in a lot of ways. Oh, Thank you so much. Oh, that's very nice of you, Evelyn. Thank you so much for your kind words. This is one of the things that makes my day. Okay, telling me that at least our page has helped, even if it's just one person. That's amazing because that is one child, and for me, one child is 100%. I know, people look at statistics and say, oh, how many people are we able to save and all that are saved. When it comes to material stuff, it doesn't matter. You say, okay, the more, the better. But when it comes to lives, children, for Evelyn, a child is 100%. You can't say, okay, we didn't save this child, doesn't matter. No, for every mother, each child is an 100%. It is not 0 point something percent for the statisticians. So it's a good thing that we've been able to help at least your child, and I'm happy that your child did not need to take any teething mixture, and I'm sure your child has all their teeth and they're doing well. So that's amazing. Thank you so much for following us. Please invite friends and family. Be an ATP evangelist. Tell people it's just about making sure that our children live and not die. We're looking forward to that day where no child in Nigeria, in Africa, will die from something that is preventable and that is treatable. In some countries like the United Kingdom, if one child dies, it's a big deal. We are investigating, they are trying to find out why, what could we have done. But sometimes I think in Nigeria, we just take it for granted that there are still many more children. No, it's not right. Our children are important, and we shouldn't be having deaths. Right now we're still having our deaths in double digits. In some places it's in single digits, and even with that single digits, any single child that dies from unexpected reason, like they don't expect this child to die, it's a big deal. It's a national story. It's a big deal. But sometimes we are looking forward to the day when we get to that point as well, where we look forward to no child dying at all from things that we can trade. So please, let's do the right thing. And please, for our mothers, while I'm still here, I like to always make reference to issues on social media, because it's an opportunity for us as health professionals to create awareness. Please register for antenatal care. That woman that died, that the husband was making videos and all that, it's really, really sad. It's really, really sad. Okay. And I know that people say money, money. Money is not the reason why people die. Because if we, even as bad as Nigeria, even as bad, not as bad as Nigeria, even as bad as things are, we will always save lives. So I'm sure that if the woman is in a hospital, like a government hospital, nobody's going to allow that woman to lose her baby because they don't have 500,000. It will never happen. I mean, we can deliver the baby first and then look for how we're going to solve the money issues. And I'm saying that from experience. These things we've done before. So the most important thing is register for antenatal care, go to the hospital. And for my women folks, please, you have ownership of your body. If you're pregnant, it's your responsibility to take care of yourself. If you need to go for a cesarean section, you can sign it by yourself. You need no husband to sign it for you. You can take decision on your own. And that's why we talk about female empowerment, financial empowerment. We should be empowered. If you're not ready to be, if you don't have the capacity, not only physically, it's not just to have sexual intercourse and get pregnant. That is not parenting. You must be able to take care of that baby. You must be responsible for that. So if you know you are not yet ready financially and otherwise, there's no point. Please, there is family planning. Use contraceptives. Don't bring a baby into the world when you are not ready. It is not fair. Okay? You must be ready. You must have enough money. If you're going to get pregnant, please have enough money for cesarean section, because you never know whether it's going to end with cesarean section. It's part of the planning. If you know you don't have the money, don't get pregnant yet. Go for family planning. I'm serious. So this is not the days where people say pregnancy fall on us. You plan for pregnancy, you plan for everything. So part of planning for pregnancy means we put aside the money. What if I need to have a cesarean section? Is it 500,000? Is it 1 million? You must have that money ready. I'm serious. And most government hospitals, I don't think they will charge you to that amount. So please just have some money, have all your stuff, have prepare for it can go wrong, it can go right. If it doesn't go, if there's no need for cesarean section, it's fine. You keep your money with you. But if it happens, then you're ready. So, and then please register for antenatal. Go to hospital on time. And let's not be going when it is already late. Doctors are not magicians. We are not God. We only care. It is God that heals. Okay. So if you don't come to us on time, there's nothing we can do. All right. So if a woman died in labor on in transit, it was already late. That means you're already going late. So please let's learn. My condolences to the family. I'm not trying to I'm saying it because it's something that is very painful to me. Okay. I'm not trying to lay blame on anybody, but I want people to learn from, let's all learn from it. Let's not just make joke around it and blame this and blame. That's not what is important. What is important for us to learn, because truly, truly speaking, another woman is going to go into labor tomorrow, and we're going to sometimes they see the same thing repeated. And I've seen this thing happen to the same woman twice. I've seen women lose their babies twice in similar circumstances, because people sometimes we don't learn from some of these experiences. Sometimes we think, oh, it's just God, oh, it's just my luck. It is not his luck. Sometimes we need to take responsibility and take the right actions. So I just want us to learn from that. And please, if you have pregnant women around you, if you have your friends that are pregnant, tell them, do you have money for CS? Have you saved it? If you need to borrow it, but just have that money somewhere. It is important. These are things we should not joke around, because it's not everybody that will deliver normally through vagina. Some people will deliver through cesarean, and there's something wrong with that. The most important thing is that we have a healthy baby and we have a live mother, a live baby. That is our goal. Whether it's through cesarean, whether it's through, all doctors know that things are going wrong. We're going to deliver that baby the fastest way possible, and sometimes that is cesarean section. So, but we must be ready for that. Okay. So I hope we have all learned. Miss Fumi, say good evening. Thank you. My baby is 8 months, 11 days. Since it's two tiny teeth pop, he has been biting my nipple. It's normal. Babies bite. So what you can do is that whenever your baby bites, pause. You can stop the breastfeeding for a couple of minutes. The babies, they know they know what they're doing. So if you pause like that, they will realize that, okay, biting mom will mean breastfeeding will stop for a minute. Then they understand that, then they can start to feed again. So it is normal for babies to start biting. Sometimes they too are biting, not because they want to be. My babies are not mean and they are not trying to hurt you. Sometimes they just want to bite on something because of that sensation. So you can give them something to bite on, and then that will give them a relief, and then you can continue to breastfeed. So no problem. Obi, I just say my 18-month-old has 8 teeth, and the last set of teeth came out in November. Up to now, no more teeth have come out. Should you be worried? No, you don't need to be worried. So your baby has up to like age of 2 years or 2.5 years self to bring out all the teeth. So don't worry about the teeth; they will come out. Okay, they will come out at the right time. Just let the baby be. All right. Okay. So I think our time is up. We got 2 more minutes and I'm sending by. So thank you so much for those of you who have joined me, those who have asked questions. Evelyn, thank you so much for your lovely words. It means a lot to me to know that spending my 1 hour evening on a Monday evening, and as it helps somebody, that is all I need. That's all the reward I need, and it's really helpful for me to be an instrument to help one baby somewhere in Nigeria. That means a lot. So thank you so much. So if you still have any questions, please feel free to go to Ask the Pediatrician Facebook group. Please post your question. Please be patient with us. We are all full-time professionals. We work in hospital. We too have to earn money. So we are all working. And so we do these things as our voluntary. We all volunteers. We volunteer our extra time. So sometimes to post a question may take us a day or so to get to it, but please be patient. If it's something urgent, please don't post it to us on the Facebook group. Go to the hospital. Always take sick children to the hospital. The ATP is not meant for dealing with sick children. A lot of people get upset when we tell them go to the hospital, and I don't understand why they're upset, because right from our welcome address, we've told you that this is not an hospital, it's not a replacement for your doctors, it's an health education and information platform. We want to give you information, like Evelyn said. Now we tell you what to do so you don't get, the child doesn't get sick. That is our own goal. So we are not aiming to treat children who are already sick. For children who are already sick, you have to come and meet us in the hospital, because that is where we are going to be able to do blood tests. That's where we are going to be able to set up a line. We can't do that on Facebook now or on Instagram. So please, I just want people to understand, because people always say, "Oh, you're already a doctor and I've already told you my health problems." Everything is not solved just because you've told me. Sometimes I need to see your baby. Sometimes I need to lay hands on that baby and feel that baby's body. I need to take blood tests, and I need to set up a line. So there are many things we still do beyond just what you've told us. Everything is not diagnosed straight away just by what you told us on. And most time you can't tell us everything. You only tell us 1 or 2 paragraphs. And when you go to the hospital, you see that babies have like case note this thick. So there's no way you can tell us everything in one line or 1 paragraph. So that is why we say sometimes we know that some cases the best advice to give you is to come and see us in the hospital. Please go to the hospital. We say that with your child's best interest at heart, and that is our primary goal, not to make you feel happy or pleased with us, but we are actually after making sure that the child gets the best. So if you understand where we're coming from, then we will all be on the same page. So thank you so much for joining me this evening. Have a wonderful rest of your day. Watch out for another teaching on Thursday, ATP webinar. And if you still have any question, please go to ATP Facebook group, post your questions there, and we will be able to answer them as soon as we can. Have a wonderful evening. Bye bye.